31 communities in 16 counties, working together to create lasting change, changes that inspire and give us hope. Through the Missouri Department of Health and Senior Services Building Communities for Better Health program, these communities are creating a culture that makes good health and well-being achievable for all their residents. Participating communities use the wisdom, voice, experience, and leadership of community residents to identify the changes that would be the most impactful to increase health equity and decrease the burden of chronic disease. They then work together to develop and implement a 3-year plan to make these changes a reality. Collectively, their efforts lead to 123 policy, system, and environmental changes which increased access to healthy foods, places to play and be active, and tobacco and smoke-free environments, thereby improving the conditions for better health in these communities. Let's learn more about how these communities join forces to remove barriers and implement sustainable changes to advance health, opportunity, and equity for all.
The funding with BCBH has definitely made us able to tackle some things that we would like to get done, including community gardens, including getting it to where, there's a better environment whenever you walk into our parks and our playgrounds and our athletic fields. And with the help of the BCBH funding, that we've completed some things, and there's obviously better things to come.
Having BCBH there, the program to help us, to guide us throughout the whole process, to provide funding, to be able to provide different things, services such as education along the way, helping with signage, like parts that we needed for that, for going smoke-free. It's nice to have them backing us and being able to help support us and moving in the right direction. It was just wonderful knowing that it was not just us alone trying to do it.
Building communities for better health in some areas allowed us to do like something completely new, but in other areas it just allowed us to progress on changes that were already happening. So for example, we have the Greenway Trail. That was a city partnership that was already in place, but something that people had told me over the years as a health educator, we want to see fitness stations, and I had never come up with the money or the means to provide fitness stations, but now we have fitness stations on the trail.
It has helped provide water bottle fillers in our schools and a couple of salad bars within our schools.
We have a series of parks, but a lot of them are not connected by any kind of sidewalk or anything like that. So there's been a lot of interest, especially in looking at and connecting those school campuses. Having that safe access for kids is a really high priority for our community.
The key word here is energy, and the people on the BCBH coalition are very, very excited about this. And when you're excited, it breeds excitement. And it was a series of meetings, a series of discussions, phone calls, emails, communication flying back and forth and up and down and sideways, all with one constantly clearing vision in mind, and that was a growing, excited, energetic community who were excited about health, about the development, about life and being alive.
This season of life, people are wondering where their hope is at, and seeing our community be willing to invest in the future of others, in the well-being of others, the health of others, has given people hope. And when people have hope, that makes them want to help others as well. Some of these investments that are happening are giving people more opportunity to find good avenues to help in those ways.
For more information about the Building Communities for Better Health program, contact the Missouri Department of Health and Senior Services at 573-522-2820 or email info@health.mo.gov.